You're listening to Fast Facts, Ask the Expert with Katrina Sanders.
Hello, friends, and welcome back to another episode of Ask the Expert. My name is Katrina Sanders, and I will be your expert this week as we dive into an extremely common question that I think a lot of us ask ourselves. And honestly, we don't even really know where to go inside of the research to find the answer. And that is 3-month versus 4-month. Which is a better perio maintenance schedule? Well, first, we have to take a step back and look at the actual intention of a perio maintenance appointment. A periodontal maintenance appointment is intended to, as we all know, maintain the periodontium. And that becomes really important because when we talk about maintaining the periodontium, first and foremost, we know that this means a patient who has a history of active and subsequently irreversible disease, where we are now performing this procedure at specific intervals. And I want to be very clear, those intervals are to be determined by the dentist in order to maintain the periodontium and or any implant replacements. So this is a patient who has a history of disease. We've treated it, or a perio specialty has treated this case. We've now determined that the patient is in a state of stability or perhaps some inflammation. However, the irreversible nature of the disease process we've now determined is in a state of stability. And now we, the treating practitioner, will make the decision to determine the interval that is best in order for the patient to be able to maintain their periodontium long term. This requires us to understand that periodontal disease is a chronic disease, that it can be episodic, and that it is a continuum, meaning there are chances that our patients who already have a history of the disease and subsequently may have risk factors associated with the resurgence of this disease may move out of remission back into a state of active disease. So, the first piece that I want to share is a piece of feedback from the American Academy of Periodontology. In their most recent proceedings, they specifically state, quote, "A periodontitis patient is a periodontitis patient for life," unquote. They specifically say that a patient who has periodontitis remains at risk for further periodontal destruction even with treatment. It is important to define a periodontitis patient as an at-risk individual because this patient requires a more intensive level of maintenance and evaluation than a patient who has not had periodontitis. They go on to say, a periodontitis patient who has been treated and is now stable should not return to a level of evaluation and maintenance identical to a patient who has never had periodontitis. So the example they use is annual or semi-annual exams and a prophy. So right out the gate, we understand that this is a critical step for our patients in being able to maintain this disease process. The next step is we have to take a look at why we would see our patients every 3 or 4 months. So this is where we look to the data, and this goes back to the 90s, where we looked at the average period of time that it takes the average patient for periodontal pathogens to repopulate back to pre-treatment levels. So on average, that period of time is anywhere between 9 to 11 weeks. Anywhere between 9 to 11 weeks is the average amount of time that it will take for periodontal pathogens to repopulate into those sites back to those pre-treatment levels. So it's important to look at this data and recognize that while this is an average patient, our immunocompromised patients, our poorly compliant patients, other types of individuals who are not going to be your average patient may even have a greater resurgence or repopulation of this bacteria. So it goes back to the answer of it depends. It depends on the patient. We know that there is certainly an average standard. However, patients are going to respond differently inside of the confines or scaffolding of that average standard. So identifying a 3 or 4 month recare is, put simply, patient dependent. Well, thank you so much for joining me, Katrina Sanders, for another fabulous episode of Ask the Expert. I look forward to seeing you next month.
Please feel free to reach me on Instagram at The Dental Wine Genist or on my website, www.katrinasanders.com. Cheers.
Thank you for listening to Fast Facts Ask the Expert. If you have a topic you'd like one of our experts to answer, simply email me, Andrew at ataleoftwohygienist.com, and we will get it on the air as soon as possible. Thanks for listening.